This is a good area to practice because it's just outside DC. We get to see a lot of children from different areas and a lot of situations for us to work on.
Our focus is pediatric special needs. You're looking at autism, Down syndrome, premature birth, brain damage, epilepsy, and so on. We have about 90 active patients and over 400 since we've opened 3 years ago.
And we're able to work individually with them, and we're also able to work in a group setting with them or in pairs, and so they get social benefits as well.
The biggest challenge in managing scheduling with the demographic we have is that everybody wants an appointment between 4 and 7 o'clock because children are in school. So we run scheduled visits. A typical client is seen weekly. When that client doesn't show up, that's essentially lost revenue.
I was working as an OT, a private OT without AdvancedMD, going through a billing service. I never knew what it was that I was doing that would get paid for. I didn't know how to communicate with insurance companies. I relied on my biller, but there were situations where she was caught up short. I ended up working a lot and not getting paid and not getting reimbursed.
We are not in the business of spreadsheets or of scheduling or billing or financials. We're in the business of providing the finest clinical services we can to special needs children.
What started out as kind of chaos has now been put into a very elegant, easy to understand structure. When the therapists look at that schedule, they know what they're going to do with that client, where they're going to do it, what kind of equipment they're going to need, where they're going to go with it, and then they trade off.
Financial reports are critical. I can tell how much reimbursement I'm getting from each carrier. I can tell immediately what the ratio is between my billing rate and my reimbursement. AdvancedMD gives me that information so I can project my actual income from month to month.
It's clear when we look at it what's happening and who's doing what. I really like it.
How would we run this practice without AdvancedMD? I don't think that's even possible, but I mean, good grief.